85-year-old Purushottam Lal is among the many elderly patients in this queue in a government super specialty hospital, the biggest in West Delhi. Like the others, he's waiting to buy medicines. Because of his foot injury, he's unable to stand. So he has asked someone to keep his place in the queue. This after he waited for an hour to meet a doctor. During peak hours after getting an OPD card, patients wait for an average of 90 minutes, a reality highlighted by a CAG report on the state of super specialty government hospitals. It says the doctor-patient ratio is declining, services are poor and nursing personnel inadequate. Despite financial assistance and availability of medical equipment, services aren't being rendered due to lack of manpower.
Although India remained a major supplier of doctors to the developed countries over the years, the domestic scenario looked bleak, with the country ranking 67th among the developing nations in case of doctor-to-population ratio.
Despite being a rapidly growing economy, India spent meager resources on its healthcare needs. In fact, the overall expenditure of the public healthcare in India has concentrated over the given that India spends only about 1% of the GDP on public health.
India has shortage of an estimated 6 lakhs. Nearly 1 million Indians die every year due to inadequate health facilities and close to 700 million people have no access to specialist care.
There seems to be a crucial element missing from India's public healthcare sector: doctors. As per data released by the Health Ministry on June 19th, there is only one government doctor for every 11,082 people. There is only one government hospital bed for every 1,844 people and one state-run hospital for every 55,591 people. This is 10 times lower than the World Health Organization's prescribed norms for doctor-population ratio.
Technology has always given a solution that could impact a population at a large. We, with the help of the artificial intelligence, have built a chatbot which functions of following manner.
The user gets to know about his disease by entering symptoms. It would reduce the easiness at users' end, as doctors' availability won't be an issue, neither would there be any time constraint.
This would help user to find out nearby pharmacies, physicians, as well as checkup centers as per the availability. It would also help keep a medical record of patients. Communication will no longer be a barrier, as misunderstanding in terms of language many times leads to vague results.
AI has been used in decades. It helps us improve our quality of life. Now, public willingness to talk to robots with AI is unprecedented. We have good reason to have an application with AI technology. Illy has had enough. Her son Tom has been crying for 2 days day and night. She starts worrying about his health. Illy decides to Google Tom's symptoms and find out he is likely to get a cancer. Illy ends up anxious, stressed and panic about Tom's health. So we come to a problematic: how can we help Illy predict accurately and easily disease and get recommendations on how to cure or avoid the disease? Instead of Googling online to face so many worrying information that are inaccurate and exaggerated, Illy can simply download the Health Assistant application and create an account so that she can make through the app a diagnosis report about Tom's health. In fact, you can even stay at home to use the app, which is connected to the centralized database with the hospital. This application will track Tom's daily routine that Illy is going to provide, in order to interpret symptoms and give appropriate advice. Illy has just received Tom's diagnosis report revealing he is only allergic to lactose. She is relieved. Transformation is on the way. With this AI application and hospital back support, it is easier and faster for more people to access, detect and predict with more accurate data.
It would drastically decrease the time period involved in consultation with doctors, as doctors would already have idea of the disease of patient. The issue would be known at early stages itself, by which it would reduce further spread of disease by following preventions. For the recommended test or diagnosis, the nearby diagnosis centers would be suggested.
it's in case if in a particular area any particular disease is spreading in a large volume. So by this we can have a track of such diseases and report it immediately to the health ministry so as to alert people of that area. As it would be available in regional language, so there won't be any language barrier between doctor and patient.
Each doctor tends to see 50 to 100 cases a day. We have to do qualitative work, but we need more manpower to take care of the population visiting our institutes. But definitely the doctors are overburdened.
We can't get a huge number of demands of doctors to be fulfilled overnight, but by this way we can surely reduce the time, resulting them to handle more number of patients at the same time without increasing their work hours.